Opioids are one of the most commonly prescribed medications for pain relief, but they also carry significant risks. From their medical uses to the growing concerns over their potential for misuse, opioids have become a key topic of discussion in both healthcare and public safety. In this video, we'll take a deep dive into what opioids are, how they work, their medical applications, the dangers of misuse, and the global opioid crisis. Stay with us to understand the full picture of opioids. Opioids are a class of drugs that include both natural substances derived from the opium poppy plant and synthetic opioids designed to mimic the effects of these natural compounds. Some well-known natural opioids include morphine and codeine, while synthetic opioids include oxycodone, hydrocodone, fentanyl, and methadone. These drugs work by binding to opioid receptors in the brain and spinal cord, blocking pain signals and often producing a feeling of euphoria, which is why they are effective for pain management but also prone to misuse. Opioids interact with specific receptors in the brain and nervous system, called opioid receptors. When opioids bind to these receptors, they block pain signals and can also increase the release of dopamine, which leads to feelings of pleasure or euphoria. While these effects are useful for managing pain, they can also lead to tolerance, dependence, and addiction, especially if used improperly. But opioids aren't just about pain relief. They can also produce intense sensations of well-being, which contributes to their high potential for abuse. Opioids have essential medical uses, primarily for their pain-relieving properties. Let's explore some of the key situations where they are prescribed. After surgeries or traumatic injuries, opioids are often prescribed to manage severe pain that other medications can't control. For patients with chronic pain conditions, such as cancer or severe arthritis, opioids are sometimes prescribed when other treatments fail to provide adequate relief. In end-of-life care, opioids are crucial for managing pain and improving the quality of life for terminally ill patients. Interestingly, certain opioids like methadone and buprenorphine are also used in the treatment of opioid addiction. These drugs help to reduce cravings and withdrawal symptoms, making it easier for people to wean off more dangerous opioids like heroin. While opioids are effective for pain relief, their benefits come with a high risk of misuse, especially if prescribed over long periods or used inappropriately. Despite their medical benefits, opioids carry significant risks. These include both short-term side effects and the long-term danger of misuse. Let's take a closer look at these. Opioids are highly addictive. Even when used as prescribed, patients can develop a tolerance to the drug, requiring higher doses to achieve the same effect. This can lead to physical dependence and addiction. One of the most dangerous risks of opioid use is respiratory depression, where breathing becomes dangerously slow or even stops. This is especially risky in overdose situations. An opioid overdose occurs when the drug overwhelms the body's systems, often resulting in fatal respiratory failure. Synthetic opioids like fentanyl are especially dangerous because they are significantly more potent than heroin and other opioids, making overdoses more likely even with small amounts. Opioid use is also associated with other side effects, including constipation, nausea, vomiting, drowsiness, and cognitive impairment, making it difficult to perform daily activities. These risks highlight the importance of using opioids only as prescribed and under close medical supervision. In the past 2 decades, opioid misuse has led to a devastating public health crisis, particularly in the United States. The opioid epidemic has resulted in hundreds of thousands of overdose deaths, and the crisis continues to affect communities worldwide. The rise in opioid misuse began with the overprescription of painkillers in the 1990s, when pharmaceutical companies assured doctors that these drugs were not addictive. This led to widespread use and, eventually, abuse of prescription opioids. In response, health authorities are now working to reduce opioid prescriptions, improve addiction treatment programs, and provide education on the dangers of opioid misuse. Preventing opioid misuse requires a multifaceted approach. Here are some key strategies to address the crisis. Public awareness campaigns are essential in educating both healthcare providers and patients about the risks of opioids and the importance of using alternative pain management options when possible. Stricter regulations and prescription monitoring programs can help ensure that opioids are only prescribed when absolutely necessary and in the appropriate dosages. Increasing access to treatment programs for those already struggling with addiction is crucial. Medication-assisted treatment, counseling, and rehabilitation centers are all vital resources for individuals seeking recovery. If you or someone you know is affected by opioid addiction, it's important to seek help. There are numerous support systems in place to aid in recovery. Groups like Narcotics Anonymous provide a community of support for individuals struggling with addiction. Medication-assisted treatment has been shown to be effective in helping individuals reduce cravings and withdrawal symptoms, increasing the chances of long-term recovery. Opioids can be life-saving when used correctly, but they also carry significant risks. By understanding these risks, using opioids responsibly, and seeking treatment for addiction, we can better navigate the challenges of opioid use. Thank you so much for watching. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to the channel for more content like this. Until then, take care and see you in the next video.